Hi guys, I am Sarang Antrapur. Today in this video we are looking the information about the clinical trial protocol or the how what is it important to make the clinical trial protocol development. Then what is the clinical trial protocol development? The every clinical trial clinical investigations begins with the development of the clinical trial protocol. Each and every clinical investigation starts with the making of the clinical trial development, sorry, clinical trial protocol development. The Then what is the clinical trial protocol development? The protocol is a document that describes the how the clinical trial will be conducted. The document that describes the how the clinical trials will be conducted, the objectives conducted, that is the objective to be the design, how they are the design methodology, or the statistical consideration and organizations of the clinical trial that should be mentioned in the clinical trial protocol document. After that, they ensure the safety of the trial subjects and the integrity of the data collected. That also be mentioned in that the also should be mentioned in that the clinical trial development protocol document. These are some information that information. This is the main basic definition of the clinical trial protocol. After that, a research protocol is a document that describes the background, rational, objective design methodology, statistical considerations, organization of the clinical research project. These are some information. According to the ICH guideline, ICH clinical practices, good clinical practices guideline, the protocol should include the following information, or the topics should be include in the clinical trial development document according to the ICH Good Clinical Practices Guideline. These are some topics that should be included. That is the title of the page, that include the general information about the product, or the drug. The general information about the drug should be you know, yeah, noted on the title page. After that, the background information of that drug, objective and purpose of the study, or the that document, protocol document we are making, the objectives of that document, study design, selection and exclusion of the subject, treatment of the subject, assessment of the efficacy, assessment of the safety. These are the some uh, how the procedure is going to the how the study is going. This is the protocol, and the information that is mentioned in that the this is the after that the adverse event. This is the main topics that should be covered in that the after that the discontinuation of the study. When the discontinuation of the study is happen, in that this should be mentioned in the clinical trial protocol development document. After the statistics, quality control assurance, uh, ethics of the drug, data handling and recording, record keeping, publication policy, project timetable flowchart, references that need to make that clinical trial protocol, supplements, appendages. These are some information that should be mentioned in that the document. The NIS provides the resources of the protocol document to assist the investigators in writing and developing the clinical research protocol that are in the compliance with regulatory or the GCP requirement. Some NIH institutes have a mandatory requirement for using the protocol template, or the this is the main this is all about the clinical trial protocol development document. In simply, it is the document that provides it is the document that provides the protocol that describes how the clinical trials will be conducted, or the design, methodology, statistical consideration, and organization of the clinical trial that ensures the safety of the subjects and the integrity of the data collected, that should be mentioned in that the clinical trial protocol document. Thank you so much. We will meet soon.